Okay, doctor, you have a book, and I'm holding it. It says "Salt Kills." You call salt public enemy number one.
Yes, I
We've
do.
talked about sugar so much. We've heard about it.
Yes.
It's all over the internet.
Yes.
How bad it is for us. Smoking, we've
Yes.
heard, but not so much about salt. Salt, oftentimes you've heard that it's actually good for us in a way.
Yeah, so you are exactly right. Is why I'm in this mission. It's a mission. I would say it's a crusade for me. I'm doing this for almost a dozen years. So there is smoking awareness. We all know we shouldn't smoke, right? So we also have sugar awareness. Actually, the manufacturing industry loves for you to say sugar is bad for you. You know why? They have million products with low calorie, ready to sell. If they will use your pitch to sell these low calorie products. But the moment you said don't use salt, the industry will crush it because they don't want to hear that. The industry wants to sell more product. So salt is a way to sell more product.
And what is your mission?
So my mission is to raise awareness of the fact that salt is killing as many or more people than tobacco, believe it or not, causing more death and disability than tobacco. It's not me saying it, it is World Health Organization saying it. Actually, as of 2003, hypertension, one of the many things salt causes, itself is killing more people than tobacco, but nobody's aware of it. Okay? So I made it my mission to explain that. If you look at this book, this is a very simple book written in sixth grade language, full of illustrations and simple stories to explain how salt is affecting your health. And I go around talking about this, and I lecture to medical groups, non-medical groups, and I also talk to minority healthcare groups because it's affecting minority healthcare groups even worse than the rest of the populations. So that has been my mission.
Very interesting. And finally, can you talk about your journey from India to the United States
Yes.
and how you got in the field that you are right now?
So I finished my medical school in Hyderabad, India. And after medical school, I came directly here in 1976 to New York. Then I did my general surgical training in Brooklyn, New York. Following that, I went to Cincinnati, University of Cincinnati, to do cardiac surgery. So I've been doing cardiac surgery since 1983. So it is 4 decades past. So I've been doing heart surgery for 40 plus years. And for the first 25 years, I didn't realize the cause of the heart disease is right in front of my eyes until something went happen, light bulb went on. Okay, so since then I made it my mission to educate everybody else. So for the first 25 years, I was busy doing what any heart surgeon does, practicing our trade, so to speak. But the last 15 years, I agree with American Heart Association, which says 80% of heart disease is preventable. 80%, I would say even more. So when I look at my schedule last week, 2 weeks, or the schedule next week, I see patient after patient whose disease could have been prevented. Okay, and I feel bad operating on patients with disease that could have been prevented. And this awareness is not there even among physicians. I get after my physician colleagues to take care of themselves. The salt-related health problems are extremely common among physicians. So I'm trying to raise awareness. So I tell my colleagues, we need to walk the walk. We need to engage in prevention. We need to lead by example. In fact, yesterday I made a presentation here, yesterday afternoon. In that presentation, at API, in Philadelphia, the birthplace of America, you know what presentation I made? I said, we all take Hippocratic oath. In the Hippocratic oath, there is a line that says, prevention is better than cure. There is a line. And I posted that on LinkedIn if you want to check it out. There is a line in Hippocratic oath that says, prevention is better than cure. So I said, we need to add another line to that. So I will promote prevention, I will practice prevention, and I will lead by example. That should be part of the Hippocratic oath. That's my statement yesterday, and I want to promote that. I hope my colleagues will agree with that and take it further. Because we as physicians need to first take care of ourselves. We as physicians first need to walk the walk, so that other people will follow.
Great. Well, thank you so much for that.
Yes,
Thank you.
Thank you.